We are delighted to welcome you all to today's Be Well webinar on mental health of youth, common issues and effective solution. She is Anjana Thapa, a volunteer at Adore, and she will be hosting this session today. Adore is a global youth initiative that focuses on empowering individuals through volunteer-led programs and sessions. Our aim is to spread knowledge, inspire, change, and motivate youth for positive action. It is our great pleasure to have Mrs. Anjana Thapa with us, who is a public health professional research. We request everyone to kindly switch on their cameras for a more interactive sessions. And if you haven't registered, please use the link in the chat. Without further ado, let's begin this exciting and insightful session. Ms. Anjana Thapa, the floor is yours to start.
So, hi everyone, I am Anjana Thapa. I'm from Nepal and I'm a public health professional and I have keen interests regarding mental health issues. So today I am over here at Adore volunteering, and I think it's been about a month or more than a month since I joined Adore as a volunteer, and it's a wonderful experience that brings youth together. And today I'm gonna present you about a topic that's quite common that's quite common these days, and it's getting a bit of hype these days, but there are so many issues, there are so many taboos related to it, and especially the mental health of youth is a big thing over here. I will talk in next slide why mental health of youth is necessary. So the topic of today's webinar is going to be mental health of youth, common issues and effective solutions. So before beginning about mental health of youth, I think over here we have few youths. So can you tell me, let's keep the session a bit more interactive. Can you tell me what comes in your mind when you think about mental health?
Stress related to exams, I guess, pressure related to your workload, I guess, for students or for working professionals or for everyone?
Wonderful. Okay, yeah. So that's wonderful to hear from you. And mental health is quite of a broad topic. There are so many aspects of it, and it's quite subjective. Unlike the physical health, different things can impact mental health. Like the same effect, or the same exposure of some kind may have different effect on every individual. That's how mental health comes a bit broad topic. And regarding youth, so I want to highlight some of the few common issues that globally youths are facing, and few effective solutions that might help you tackle it. So I want to present you some global facts and figures that you can know what's the status of mental health issues in the world. So 1 out of 5 is 9 to 17 years has a diagnosable mental health disorder. And that may range from eating disorder, panic attacks, anxiety, depression, or more serious mental health issues. And the fact over here that 50%, that means half of these mental health issues begin by the age of 14, and 75% in the mid-20s. That means youthhood is a period that is quite vulnerable to mental health. And next fact over here, I will present you that is quite shocking and it's quite alarming too. Suicide is the 4th leading cause of death among individuals of 15 to 19 years. That means the teenage period or the late adolescent period over there. Suicide is the 4th most leading cause of death. So these are few of the common mental health issues among youth, and I got these data from various websites, mainly WHO, World Health Organization, and we have anxiety disorder over here. Next is depression, and the next is attention deficit hyperactivity disorder, also known as ADHD, and the next is behavioral disorder. And in fact, so many people the vulnerability of these mental issues differs from people to people, from age group to age group, or by gender wise also. For example, depression, talking about depression, there are many kinds of depression: seasonal depression, Some people, if they live on the area where there is like less sunlight, then they are more prone to seasonal depression and postpartum depression. And the other one is depression of during the elderly period, geriatric depression. And who is more vulnerable to depression? So women are more vulnerable to depression. And regarding the ADHD, also known as attention deficit hyperactivity disorder. So male are more vulnerable to ADHD as compared to female. Whereas anxiety disorder and behavioral disorder can differ. It can differ from people to people, gender-wise to gender-wise. And behavioral disorders like eating disorders, it includes that. And let's move on to the next one. So I talked a few minutes ago why I will come to the point that youth are more vulnerable to mental health condition. So there are a few factors that makes youth more vulnerable. So youth is defined by different age group. Some like WHO, some UNICEF, like they define youth as differently, but in youth is more commonly a period between adolescent to the early 20s or to the late 20s, before people are transitioning into the adult period. So why are people more vulnerable? That one thing is due to developmental changes. As a child progresses towards adulthood, there are a lot of hormonal changes in their body, and that may include from more risk-taking behaviors, or taking things too personally, and hiding things, trying to fit into their societal pressure, their peer group. And the next one over here is social pressure. So the social pressure is that may range from being trying to fit in a society, or trying to fit within a group. And it might be, and over here all age group or all gender might be vulnerable, but women and LGBTQ communities are more vulnerable because they often try to fit into these social boundaries, and that can lead to mental health issues like depression, like ADHD. And the next is exposure to adversity. That means that may range from family conflict, abuse, or exposure to violence. That may be physical violence, mental violence, economic, or even social violence. And the next is bullying and discrimination. So bullying is quite common these days, and there are steps being taken to address these things. So bullying can also lead a child to mental health disorder, or a youth to more vulnerable to mental health disorder. And the next is discrimination. It may be social discrimination, cultural discrimination, so it may range. And the next, I have kept this on the last, but it's one of the most growing cause or growing factor that is impacting our mental health. That is digital and social media influence. So this is a generation where the technology has advanced, and there is a growing virtual world. And with that, in that world, there are a lot of attraction, short dopamine, that can influence that can impact mental health conditions. Why? Just think about it, that in a reel, or while we are scrolling in the social media, we come across a video of maybe some African country, maybe some tiger, lions, and after the next 60 seconds, there comes someone doing scuba diving on some other part of the world. That transition, that short-term dopamine, can make people more addicted to our social media, and which in fact can lead to mental health conditions. And the next thing that's quite common these days, that is part of the social media, is comparison. There are so many advertisements these days, and people tend to compare themselves with the one who is on the screen. And comparison can lead to maybe low self-esteem, lack of confidence, so which might directly or indirectly influence mental health issues. So what are the consequences of those mental health issues? So the first one I have kept over here is increased risks of self-harm behavior, and it may range from cutting or even pinching or even societal behaviors, or it may come to substance abuse, or drug abuse, alcohol abuse. And the next is academic challenge. Since youthhood is a period where people are engaged in the academic, that may influence, that may impact if they cannot focus on their academic. Next comes over here, that is social isolation, impaired emotional and social development. Well, this point, impaired emotional and social development can quite be seen these days, I think. Many people feel emotionally vulnerable, or they lack the level of trust in relationships. That might be due to mental health issues like anxiety, depression, panic attacks, or some post-traumatic experience. And other things are economic burden and risk-taking behaviors. I mentioned it in the second point also. So so the next over here is what can be done. So can you tell me out other point beside here that I have shown in these slides? What are the other effective solutions and intervention to tackle these mental health problems? Okay, let me first tell out these, and then you can add on to that. Okay. So the first one and the most it can be easy is talking with someone we trust. That means that can make people feel heard, people feel relief, and can also get them to help. Next is exercising regularly. It may include a simple walk, jogging, or some gym if going to gym, or doing some squats, lunges on in their home, or even doing yoga. And the next is early intervention. So there are like many different stages of mental health conditions. Like there is like mild, moderate, or severe. So if we catch on those symptoms earlier, then the solution would also be easier. If mental health issues progresses on towards severe stage, then medical help might be really important. But if we catch it into their early stage, or if we recognize that these symptoms are I'm feeling such symptoms, then they can the solutions can be easily available or less costly. So identifying yourself and around yourself is really important. If someone is feeling stress or under the moon on a long period of time, that might be a symptoms of depression. So like knowing these symptoms and sign can help people identify themselves or people around themselves to get the early intervention. And the next one I have kept over here is limiting your screen time. So I think there was a report that in average people spend about 3 hours in their mobile phone. So that means they spend almost 30 or almost 10-20% of their time in using mobile phone. That means they are becoming unconsciously, they're like subconsciously scrolling through their mobile phone, which can make them feel, which can even impact their physical, mental health, like comparison, low self-esteem, engaging in bad activities, social bullying, cybercrime, and all that. So limiting your screen time is also one effective solutions or intervention to these mental health condition. And the next over here is e-mental health. So as we are in this webinar, I want everyone to focus on this, because e-mental health means electronic or the web-based mental health tips So there are so many tips actually. So I want to highlight few of these. So over here we have, let's start from telehealth. Telehealth means doing online consultation with psychologists, talking with friends, talking with similar support groups. And the next is wearable computing and monitoring. So mental health issues also impact physical health. So if people are getting more stressed, they are getting depressed, or they are about to have anxiety, then they can wear some electronic watch, and which can track their blood pressure, their heart rate, and can make them aware regarding that is going to happen, and people can then take the early intervention. Next over here is online resource and apps. So I think Adore also fits over here because it's a unity of people who are over here to empower youths. So online resource and apps. So virtual reality, it's like watching something using the virtual reality. And the next is online support groups. These support groups can be found through various social media platforms like Facebook, Instagram, and the next over here is digital assessment and diagnostic tools. So it's a common tool where people share kind of a form, and they are like told to rate out in the past last week or in the past last month, how have you been feeling? The option might be A, fine, all right, under the weather, under the moon. And how long have you been feeling this? 1 month, 2 months, 3 months? And at the end of that, that might give you a result, which might tell you if you are vulnerable, if you need help, or if you are in certain stages of some mental health disorders. And the next is therapeutics gaming. So gaming can also be one of the way to distract people from these mental health issues or conditions. Like if people are overthinking some kind of things, then engaging in a good entertainment game, like maybe plucking an apple, going to some gardens and doing some gardening, like therapeutic game, that can help. And the next over here is digital treatment programs. So over here, UNICEF itself has a digital platform where it provides free, I don't think it's free or not, but it provides different mental health services like counseling. And there are there are so many paid mental health programs where people can select their physiotherapist, their psychologist. They can choose their time period. They can choose, so that's mental treatment programs. So, and the last one is this is online. This is consultation, getting the medical help, getting the professional help. So beside this, is there any point that you want to add? You can put it on the chat box, or you can unmute yourself and tell any point that might help intervene is mental health issues like depression, anxiety. Okay, so looks like I covered it. Is there any question for you guys? Focus on personal growth. Oh, that's nice. Yeah, personal growth, like it may differ from people to people, like maybe waking up, making a schedule. That's really nice. And sticking to your plan. So is there any confusions or any experience that you want to share yourself? Or you can even write down in the chat box, or if you feel free, please unmute and please share. Okay, so looks like there's no question. Okay, it was nice having you. Yeah.
Ma'am, we do have some questions. Sorry about the delay. I was just having some
Ma'am, we
issues.
are writing the question
So,
in chat box.
yeah, ma'am.
Okay, all right.
So I would go first. I wanted to ask, ma'am, yeah, what role does early intervention and mental health education play in preventing long-term issues in youth? Like, is it helpful? Because on some people, like they try to intervene on the early basis before these mental health issues, but sometimes it doesn't work out. So, according to you, what role does early intervention plays in mental health usually?
So early intervention is really effective in every aspect of health. Just think of it as like a physical health, as there are many stages of the disease, and as the disease progresses, the dose of the medicine increases. And the same goes for, like, let's take an example of depression. So if people catch on the early symptoms of depression, then they might not need medicine or even psychologists. They can change their schedule, maybe they can change their environment, and they can recover themselves. So that is one role that plays important role in early intervention, and catching the disease or catching the issues early makes the solutions more easy and recovery much more faster and improves the quality of life also.
Okay, ma'am. There are more questions in the chat box. You can view them as well.
Yeah, okay. So, Priya, okay. I want to ask that sometime it happens we have no one to share problems, then what do we should do? So for that, I missed one point, that was journaling. Journaling might be a really nice thing, because yeah, it might be because people might not feel secure, or people might not trust their feelings or with their emotions to share with others. And in such time, writing out a journal, or if you are good at writing, maybe expressing yourself through some poems, through stories. So it's like a letting yourself out. So talking with someone is just a form of letting the inner thing out. So it can be by journaling or by poems. Maybe if not, then listening to some songs that might you relate.
Thank you, ma'am.
Okay, yeah. So the part of here is asking, how can parents and guardians effectively help youth cope with anxiety and depression? That's a really nice question, Parthavi. Yeah. So there is a wide generational, not a gap, I would say, but as the technology has progressed and as the world has progressed, the mental health issues has also progressed. And if parents and guardians might feel that mental health issues are not real issues, that might happen, especially I think in the context of South Asian household, that people do not count mental health issues as a health issue, but they count it something as attention seeking or some stigmas. So the effective solution for parents and guardians might be through school or through their colleges, maybe having some programs related where parents can engage and they can know. Maybe like Ado right now is doing a program over here. Maybe parents can engage in such programs where they can know about such vulnerability of their kids regarding mental health. And also, if children can also talk with their parents, and that can be also a good way besides school programs. So let's move on to next one. Does having heartbreaks cause mental issues? How can we know if we have one or not? Yeah. So yeah, the heartbreaks, it can impact, but I will not say it can directly lead you to mental health issues, but it can trigger it. If you had previous mental health issues like depression, anxiety attacks, or panic attacks, and if you had recovered it, and if you got into another heartbreak, that might trigger that past depression, that past anxiety. So it differs upon people to people, actually, how they cope it. Do they cope it well, or do they do not cope it well? So the answer is quite subjective. I told previously that the same effect, the same reaction can have different consequence in different people. So that's how broad is mental health issues, and how to know if we have one or not. And this is like quite common when we search the Google. There are so many symptoms, and people feel like they have all of those symptoms, all of the checklist. And so one thing that might help to identify if they have certain mental health disorders is one common thing is if they have a longer period of such feelings, like maybe weeks, months, if they're feeling the same feeling for weeks, months, and if that is affecting their daily habits, like their sleep schedules, their study habit, their focus, then that might be the good time to seek out a help. That might be through a friend, or maybe putting it out on some social media. I'm feeling this. Do I need help? If best is to go through a psychologist and express those feelings, and they might tell you if you are having that problem or having that mental issues or not. So over here, what are some community-based interventions that have shown positive result in improving youth mental health? So one community-based interventions are the local groups. I think there are, especially in urban areas, there are many groups like Leo group, Rotaract group these days. That's quite a nice group where one thing about youth is that they kind of relate. If they relate with other people, then they flourish their themselves over there. If they are in a group where there are many youth people, then they will express that. So one community-based intervention would be local community groups, local clubs with youth, and also maybe with some psychologist or some mental health expert that can identify or that can track them to good mental health thing. Let me know if I'm not answering your question, okay? I can answer it again. So Parthavi over here says, what role does early intervention in mental health education play in preventing long-term issues in youth? So yeah, mental health education goes a long way, I would say. If people know how to identify, how to know those symptoms, then that can be life-changing. It's like a habit, actually. So as people are developing their habit, their coping strategies that may last their lifetime. For instance, we might have seen some kids, actually, they kind of have same habits all their life. So as in during mental health, during youthhood period, as people are being exposed to stress, if they have good coping mechanism, then they will follow that habit lifelong. And similarly goes for bad coping mechanism or unhealthy coping mechanism. Like first instance, many sometimes youth come into the peer pressure, and they start doing smoking, alcohol, drugs, and that can make them lead to their lifelong smoking habit. So the same goes over here into mental health too. If they have good coping mechanism, then that can lead them to lifelong good coping mechanism. So yeah, I think I answered the early intervention one before. What are some common misconceptions about mental health and depression? Oh, this is a good question. It goes a long list, actually. And it differs from people to people. So there are like so many terms that is so sensitive, and people call out it as attention seeking, crazy, and it's just a phase, and it's just a phase, and like trying to fit them into their societal pressure. Like one common one, I think, especially in South Asian context, because I think we have Nepalese and we have Nepal and Indian. So people often say that having depression is people do it. People develop the symptom and the cause and all solutions by themselves. So they think that the mental health experts are total bust. They don't count themselves even as a professional. That's a common one. They think that's a crazy doctor. That's a crazy person. Oh, that person is wasting so much money in such unnecessary stuffs. Especially therapy is a big taboo, I would say, in communities, and especially in rural areas. If someone is going to therapy, then that person is looked as if they have committed some crime over there. If a person is found smoking, then maybe people would say something to them, and it will pass. But if they find someone going to therapy, then there are like so many instances where the guardians will tell their kids to not to be friends with such people who are going to therapy. that's the condition. There are so many taboos actually, and taboos, stigmas, and myths regarding mental health issues. So yeah, I have someone is sharing experience. I think I have a friend. He's suffering from depression, but it's really hard for me to make him do anything like all these activities. Is there any easy way which make them do stuff rather than being sad and depressed? So yeah, if the person has been clinically diagnosed by depression, so that means if it's on severe phase, then nothing all I told before, these like schedules, some limiting screen time, they might not be even looking at screen even five minutes a day. So that might not be effective for them. So if they are at a serious stage, then psychological help is all that can be helpful for them. And being a friend, being a shoulder to lean on, being there, watching them, and making them feel that that person has you to talk, to express. That might be one way to be there for such people. Empathy, empathy is a big word over here, trying to understand the person, like but it's not easy as it is said, because the person who is going through such issues might not be too expressive, might not want to interact with you at all. So if possible, I would say if it's already diagnosed and it's severe, then let psychological help be the best one for them, and with medication can also be helpful. And as a friend, you can be a shoulder to lean on, a friend to listen, a friend to always be count on, checking on them. That might be some solutions. Is there any more question? It's really nice. You have so nice question.
Thank you, ma'am.
Thank you. Yeah, thank you, Priya. And regarding to Yatin's friends, may he recover soon and may he find the good help that he needs. And also mental health services cannot be quite accessible or quite. There are so many things regarding mental health service. It can be costly, first of all. It can be difficult to find your preferred mental health solutions, and it might not be accessible. Like they might be far away, or they might be on some other part of country. So there are many issues regarding mental health services. I think the government or the stakeholders of the country is more responsible to manage these issues. But rather than that, I would always say everyone in mental health, take care of yourself, identify your stress, your triggers, and try to develop good coping mechanism, journaling, dancing, singing, going out for a walk, and be a shoulder to lean on, be a nice, if you notice someone, talk to them, say hi to them. So I think I still have one more slide that says a quote actually. So the quote goes like this: strength in seeking support, you are never alone. So with that, if you guys do not have any other question, we can end today's session. It was really nice having you all.
These are the only questions that are there, and I guess we are now complete. So we can conclude our webinar today right now. As we conclude this engaging session, we would like to extend a heartfelt thank you to Ms. Anjana Thapa for her invaluable insight on mental health among Indian youth. Her expertise and thoughtful guidance will surely help educators in navigating the online teaching environment with greater confidence and effectiveness. We also thank all of you for being such wonderful participants today. ADOR is a non-profit organization committed to motivating youth and providing volunteer opportunities for individuals passionate about making a positive impact. Before we leave, please take a moment to fill out the feedback form shared in the chat. Your feedback helps us improve and offer even better program in the future. Thank you once again, and we look forward to seeing you at our future webinars. Have a great day ahead.
Thank you, everyone.